Today is October the 9th. It's about 1:45 a.m. I can't really sleep. I haven't made one of these in a while, but I can't sleep, so I thought I might as well try to throw one of these down while I can. I do have some pain pills right now that make it so I can at least kind of sit up and do something. This carpal tunnel in my wrist is getting so bad I can't even hardly use my mouse. I'm in a new place now, and I guess I've made one of these since I moved in here. But there's been a lot of changes, a lot of stuff going on. A lot of stuff that I need to take care of. Some of it is getting to the 2-year limit or whatever. I filed since can't seem to get anybody to help me down there. I was in the hospital for a little while. I went down there to see my primary care doctor about a month ago. So just doing that hurts my wrist so bad. Right there on the top, right there. It hurts so bad. So, anyway, there's people out there that watch this stuff. I guess they ain't got nothing better to do. I know I look around for just stuff to watch sometimes. And maybe the chance that somebody someday, sometime will see this and maybe help us. The VA is just a terrible, terrible thing. And I mean, I can only speak for my own personal experience, but I can't even hardly do that. My wrist hurts so bad. Personal experience, but my personal experience has led me to believe that that the alarming number of veteran suicides every year could have a lot to do with how the veterans are being treated at the VA, and what people may or may not know, that having VA benefits excludes you from other programs like Medicare, Medicaid. If you have VA benefits, they won't give you Social Security benefits, so I can't get Medicare or Medicaid, and I'm forced to use the VA. I have nowhere else to go. I get pushback from people when they find out you're a veteran is why you don't go to the VA. But the VA is not helping me, and no matter who I tell, and nobody seems to want to document it or do anything about it. They just kick the can down the street and do the same thing over and over again. 6 years I've been going through this, 7 years now. That's all I got to show for. My teeth are falling out of my head because of the medicine that they gave me, and they injected me with something down there in the ER. It poisoned me. It kind of burned me chemically. Burned me on the inside. My nervous system, it's messed up my nervous system. My feet are burning now, and they're always burning. The more I move around, the worse they burn. The more I try to do actively. I try to do as much things as I can. If I hold this cigarette like that, maybe it won't hurt me. To do things to take care of myself, to be able to live on my own. My sweet little Red back there. Come on, Red, what you doing back there? He's another pathetic, beat up, need to go to the vet. I need to go to the doctor. My neck, they say now they're going to operate on my neck. Oh, God, he's sick. He needs to go to the vet, too. I can't afford to take him to the vet. He was starving. I found him emaciated about 8 months ago, and he's got something wrong with him, and I got something wrong with me. I just kind of wanted to set this down while I was thinking about it. That's all I can do sometimes with these pain pills. The pain goes away, and then all I'll do is just lay here. I can't sleep and think about all this stuff down there. Stuff that's not done, stuff that I just can't seem to get done. I'm supposed to have a caseworker down there, and because I complained about the caseworkers not doing their job, they basically now have taken all the caseworkers away. I don't have a social worker working with me. The ACT team is no longer working with me because I complained that they weren't doing their job. So they quit coming here. Told me I had to go to the Conroe Clinic. Been telling me to go up there like once a week. I can't hardly get up there. I can't hardly get to my physical therapy. It hurts me so bad to get out and get around. Trying to do these things, but I went down there for a test. They did the test on the wrong side. They want me to come back and do another test on the other side. It's like a 35 miles to the VA hospital from here in Houston traffic. Up and down I-45, it'd take an hour to get down there. I can't hardly do it, but I tried using MetroLift. That takes like 2.5 hours one way on MetroLift. I can't sit up that long. They gave me a scooter, but my car won't carry the little scooter, so I can't really use that. So I guess I'm just gonna have to crawl into the hospital now when I go up there for my appointment. I can't roll my wheelchair. I can't use my hand anymore because this carpal tunnel syndrome has gotten so bad from using it so much in the last couple of weeks trying to go to these appointments, and just everything seems to be falling apart. Had some helping me get my driver's license. That took 2 years to get that done. Went to get my driver's license, and then now I got to send off for a birth certificate. Managed to get the form printed out, but it's been down there like 3 weeks on the floor. I can't tell you why. I struggle to do these things, but I just get these panic, anxiety, and I'm usually, like I said, I can't hardly do anything but lay here on the bed. So I went down there to the VA about 6 years ago. What I would call routine. My back has been going out since I hurt it back in the military when I was a young man. I was 22 when I hurt my back, active duty. And since then it has gone out, several times, 2 or 3 years it goes out. It just seems like it's creeped up my back now, and I've got bad discs in the middle of my back and in my neck. They told me they couldn't operate on my neck because surgery would have to go through my throat, and they couldn't do that, and now they're saying that they're going to do it out of the clear blue. All of a sudden they're going to do it with no new images, no nothing. It just went from saying they couldn't to now they're going to. I don't know. I don't even trust them, but I don't have any option. They're not treating us with any type of pain medication now. The pain medication they give us is useless, so I just lay here suffering, and sometimes I can't stand it so bad it's making me want to just die. I'm suffering to death from this pain, and all they want to do is lock you up in the hospital down there, and you tell them you're hurting too bad, you can't stand it, and they lock you in the hospital for a week. Had me in a bed with no TV, staring at the wall for 6 days, and sent me back home into the same situation I was when I got down there, and they put me in there. So other than the fact, like I said, they've taken my case managers away from me, my social worker. Now I don't see some doctor up there, psychologist or whatever, but he don't do nothing. He just they don't seem to do anything, but they're saying they're going to do this neck surgery now, and I don't even, I'm afraid to do it, but I don't have any choice. I'm suffering so bad from this back pain. I got to do something to help get If it fix my neck, maybe I can deal with my lower back and my middle of my back. I don't know, but I can't keep living like this. And the VA is just from day one it's messed me up. The doctor they just make assumptions down there. They're not trained. They have no training. There's a training hospital is what they call it. The doctors aren't trained. They're there to learn, so they don't know nothing. Because they're doctors, they think they're so smart that they just know everything. My doctor, first thing he told me, I was too young to have back problems. Now 6 years later, they've identified 2, 3, 4, 5, 6, at least 6 bad discs up my spine, arthritis in my shoulders and my back and my neck, carpal tunnel syndrome in both wrists. My knees are bad. Well, just I've been overexposed to heavy lifting and pulling when I was in the Air Force. I just tore my body up doing that stuff. And now it's killing me, and the doctor didn't even take that into consideration. He just says you're too young. You're just here. You're trying to get these drugs to sell them. Then it was you're trying to get these drugs to abuse them. Because I told him, in the past I've had medical insurance, and I've always been able to get past this. With a effective pain management. With rehab and occupational therapy and chiropractor, whatever. And then whatever pain medication. I mean, this is, taking stronger and stronger pain medication over the last 20 years. I've had this problem, but I've never been on that medicine more than maybe 4 or 5 months. It took me to heal, to get back on my feet again. The VA, they just do one thing at a time. They just give you pain medicine, and they just do physical therapy. It's 6, 7 months apart. They don't follow up with anything. The pool is broken. I don't know. It's every time I go down there, it's like it's the first time I've seen somebody, and nothing ever seems to get fixed or gets accomplished. I'm just getting sicker and sicker, and I'm afraid I'm going to end up like so many other veterans, that give up. But I went there 6 years ago, and this doctor, misdiagnosed me as incompetence. Put me in this program for pain management that was a drug treatment thing. It's rotted all my teeth out. I wasn't even seeing a doctor for 4 years. I didn't see a doctor. I was just taking that medicine and just basically had like a zombie until the pain started hurting me so bad, that I went back to him and said, this is not, I'm not getting any better, and this methadone that y'all are giving me is not working. And they tell me that that's not for pain management, and the doctor put me in a drug treatment program for my back. And didn't do anything to help me with my back. Just basically knocked me unconscious with that medicine. I slept all the time, and my teeth fell out. And I finally get down there to see a doctor that orders images, and they find all this messed up stuff in my back, where I've been telling them that my back is hurting between my shoulder blades. They're telling me that's because my neck is messed up. It took a year to convince them to do an MRI that shows this bad disc in the middle of my back. And over that period of time, they were telling me to do physical therapy for my neck that was just putting all that pressure on this bad disc that I told them that was in the middle of my back that they ignored. It's just idiots down there, totally incompetent, making me do things that hurting it worse. Now the thing goes out almost every day. It'll go out. If I lay in the wrong position, it'll go out. Feel like there's just an ice pick stuck in my back, and sometimes I can't bear it. So this doctor, puts me in this thing that they don't really look at my back. They just make these assumptions that was a drug addict because I told them I had taken methadone, but that was a methadone that was made for pain management by a pain management doctor who was giving me injections of steroids in my neck and having me do physical therapy and all this other stuff. And he put me on the methadone because I told him I didn't want to be, that the opioids were making me kind of cloudy and couldn't think or go to school. So he was giving me morphine sulfate, fentanyl. couldn't think, couldn't function cognitively. So I went on to this methadone to so I can maybe continue with my studies and what have you, which I did. And as soon as I got better, I quit taking it. I didn't need it anymore. But I made a mistake of telling that doctor down there. You try to be honest with your doctor. I tell the doctor that this guy was giving me methadone, and I did that because I didn't want to have an operation. They wanted to operate on my back when I was like 32, and they condemned me for that and accused me of being a drug addict because I wanted to take drugs rather than let somebody operate on my back. Which that's the last thing you'd ever want to have done, to somebody operate on your back. And when I went to the VA, and they weren't doing their job right. Left me with no option but to have surgery. And they messed that up. Now that area that they operated on is killing me too. Where they put them screws in my back, I can't lay on my stomach now. I can't lay on my stomach now because of the way they've screwed my back together. And I think they did that wrong. I think that they had put me under with some fentanyl before the surgery, and I don't think they're supposed to do that. That guy's supposed to know. I can barely remember. It just comes to me like in cloudy bits and pieces, but it seems like that guy was asking me during the surgery. He was talking to me. He says, "Does that hurt? Does it hurt?" I can't remember, but it seems like they were doing that. If I was on that fentanyl, I didn't know that it was hurting or whatever. I couldn't answer him right because I was, my pain sensory was numb, and they went too far or did too much. I don't know, but I can't lay on my stomach now. I lay on my stomach, my feet start burning in like 20 seconds, and then they'll burn for hours after that. If I sit down, my left foot turns red as a beet. I mean, you can physically see that there's something wrong. My left leg is shrinking. I can't, nobody down there has even measured the diameter of my leg to see if it's, to monitor that. That's some of the first things that they did when I had private insurance, was monitoring your leg and all this stuff. And now, they give me this medicine, make my damn titties swell up like a woman's breast. I tell them that, and they just ignore that and just make me take more gabapentin and muscle relaxers and and so I just lay here, suffering to death. Supposed to have these people helping me and get my driver's license, get my help with some of these programs. I've asked them to help me get a phone, get me one of these phones before my phone gets turned off. They were supposed to be helping me do that. That's like 6 months ago, and 2 or 3 caseworkers ago. So, one caseworker comes, another one goes. We're gonna come and hand this person off to you, so I'll introduce her to you. They never show up to do that. They're supposed to be contacting me once a week because I'm on this crisis team, and it'd be a couple of months go by and I didn't talk to nobody. I complained about that, and then they start talking about these YouTube videos and don't want me to make recordings of this stuff, and it's the only thing I can do is to make recordings of it, to try to expose them for what they're doing. They're totally incompetent down there. Everybody, the doctors are, the social workers are, the caseworkers are. They're all new and experienced or don't care. They just kind of get shuffled around through the VA system because they suck. People complain about them and don't want to work with them. They just move them from department to department. And they just end up, working here for a year, there for a year. They never learn anything about their job. I haven't had anybody down there at all talking to me about programs or benefits or helping me get any of this stuff done that I need to try to get done. I can't seem to get any of it done. I can't hardly lay here on the bed. I've got this thing here on my left side now where I can kind of my shoulder is giving out, and my carpal tunnel syndrome in my right hand is getting so bad I can't hardly use my hand, and I've been leaning on that shoulder and arm so much it's just driving the shoulders, just driving it up into my neck because I can't lean on my left side. And I've got so much stuff I need to have taken care of, and I need some help, and I'm not getting no help from the VA. And I'm supposed to have caseworkers and social workers and doctors and specialists, and none of them seem to know what none of them are doing. They send me down there for a test and they do the wrong test. Lab work. They're infatuated with doing lab tests, blood tests, and I guess that's because of the contracts that they have. The home health aid people that are supposed to be coming over here to help me with my apartment and my hygiene or whatever, don't show up half the time. They're supposed to be helping me with that. You talk to them, they never come back, and the next time you see them, they forgot about everything. Talking about something totally different, or something that was, I don't know, it's unbelievable, supposed to be helping me get a neurology appointment, and she comes back and she starts talking about orthopedics, and I'm like, it's already over with. That orthopedic stuff has been done. Now I'm trying to get into the neurology people, and I can't get nobody over there to schedule me for an appointment. And you work down there at the hospital, you're telling me you're going to go back down to the hospital and go over there and get that done, and then I don't see you for another 3 weeks. You tell me you're going to come back next week and follow up with me. I don't see you for another 3 weeks. They show up to the hospital there. They put me in the hospital for a week, lock me in there against my will. Come in there telling me they want me to take these YouTube videos down because I'm complaining. I told them that, if y'all were doing your job, I wouldn't have to put these YouTube videos up there. I've been asking to get into a handicap accessible apartment, for 4 years now, and still not. They're supposed to help me find a place to live. I moved into this place. I found this place. The housing specialist guy took me from one ghetto to another ghetto. So I told him that's why I'm moving, because where y'all put me was unsafe and filthy and dirty and disgusting and infested with roaches and crime and drugs, and this is where y'all put me, and wasn't even there for a year. I've never lived somewhere for less than a year, and then I've got to pay and figure out how to get my stuff moved, because I can't move anything. I can't carry a box of stuff. I have to have everything, somebody carry everything, and move from one apartment to the next. And that was done in a rush because my caseworker failed me there. I got sent a bill from that last apartment for $700, and the case manager was telling me all that stuff had been worked out and arranged that I could stay there and wasn't going to be no issues, and they didn't do none of that. They just pushed that down and let it, we'll deal with that next when he finds out that, we lied, and now my application for one place was turned down because they said I owed this other place money. I thought I had money coming back from that place for, my deposit or whatever. And they're saying I owe them money, and I don't owe them any money. I paid my rent all the time on time. But I had no case manager helping me, nobody monitoring that stuff. They're taking advantage of us, through this whole program thing. They're putting people in these ghettos. It's supposed to be safe, affordable housing. It's not. They charge us $65 a month for water and sewer. $65 a month for water and sewer is what I'm paying right now for a one-bedroom apartment for a one person. $65 a month. The last place was $45 a month. No deposit, but $145 non-refundable application fee and another $50 something fee. $200 to move in, $400 to pay movers to move my stuff because the VA was supposed to be helping me with that and don't show up with the truck to help me get my stuff moved. I moved all my stuff into this place, this last place, and ended up having to leave there under a police escort because they were shooting at us in the parking lot. And the guy wants to move me to another bad area. I had to find this place on my own because the housing specialist was incompetent. And this place is not handicap accessible. On my scooter, I can't even hardly get it in and out of the front door. It's wide enough, but I didn't think about it being deep enough. There's a corner right there. I can't hardly get my scooter in and out to get around outside and go outside and not just be inside all day. That's what the scooter was for. Can't hardly use it. I can't. Not a handicap accessible apartment at all. It's hard to get in and out. And they're saying that I'm good here. No, I'm not good here, but I can't afford to move again. I had to move to that last place. I had to move out of there. I had to put my stuff in a storage building. It took me 2 months to get into a new place. The social worker was telling me to live in a tent in the woods for a little while. That's the VA social worker. They lied to me. There's a video of that on here. HUD-VASH lies. So I hadn't made one in a while. I just wanted to throw this down. I can't do nothing but lay here anyway. I think my computer's so full of these videos, it's about full anyway. So I don't know how much more memory I've got, but I'll just put this on the cloud or whatever and delete it. And it's just a new one since I hadn't made one for a while. But the VA's always saying that they're fixing things, but that's just how they push it down the road. Nothing ever gets fixed. They blame everything for this, that, and the other. Say it's not hurting anybody, but it is hurting anybody. They said that training problems caused us not to use the Veterans Choice Program, but it didn't hurt nobody. No, I got put in the hospital for a week last year because of getting so sick, trying to deal with all that stuff. So it is hurting people. They lie. They told my congressman that, or my senator that my MRIs on my shoulders were clear. The MRIs, my shoulders weren't even brought up in my complaint, and they never have done the MRIs on my shoulders. So that was just a lie. Just saying something and making something up to put down and say, oh yeah, we checked the shoulders out, they're good. They didn't do nothing. My shoulders aren't good. I just lay here. I don't use them, so they're I can't feel pain hardly anywhere in my body because of the pain in my back and my neck are so bad. I can't feel nothing else. I'm just laying here dying. Nobody seems to care. Congressman doesn't care. My senator doesn't care. Can't even get Sheila Jackson Lee's people to answer the phone up there. Told them I was struggling, that I needed help. I got locked up in the hospital. Never heard back from anybody. That just shows how much they care. They don't care. So anyway, this is just an update. Nothing's changed from the last video that I made. VA still sucks. The veterans are still dying every day. How many are dying because they're not getting the help that they need?